We used to think that addiction was a behavioral problem, in fact, a social problem. When I was in medical school, they taught us that when we took a history, that is, we asked questions about the patient's medical past and surgical past, and certainly what it was like for that person to grow up, that any mention of alcohol or drug use, we were supposed to write in the social part of the history rather than the medical part of the history. Now we know much more about addiction, that it in fact is a brain disease. It affects the brain in a way that many other psychiatric illnesses affect the brain. Because of this, when someone is experiencing behavioral symptoms, or mood symptoms, or anxiety symptoms, or thought symptoms, it's extremely important for that person to be evaluated by a physician, particularly a psychiatrist who is the expert who focuses on brain function, particularly with regard to psychological function. We know that addiction affects that part of the brain which regulates mood, regulates anxiety, affects the motivation reward system, and also what's called the behavioral inhibition system. That is, the capacity to put brakes on behavior. We notice that people who suffer from addiction often engage in impulsive behavior, which gradually becomes compulsive behavior. They're driven to complete one task only, and that is to acquire and use a substance, drugs or alcohol. These are just a minimal number of ways that addiction has changed the brain. We now have the evidence that it is truly a neurologic disorder, and for that reason needs to be treated by the person who knows how to treat the brain disease, which is the addiction psychiatrist.